I would firstly just like to say that I'm so grateful that each and every one of you have taken the time out of your day to join us to learn more about scoping reviews and how to extract, analyze, and present data in scoping reviews. We know that this is a potentially very challenging area in scoping reviews. I know the very first time that I did a scoping review, I actually had no idea what I was doing. Many people have probably heard the story of Lucifer. That was what I named my very first scoping review. And a lot of it was because I sat there going, how do I actually bring this evidence together? I knew exactly how to do the search and all that, but what do I do once I have the evidence? And so hopefully we're going to really break all of this down, be very how-to today. We're hoping to have lots of opportunities for question time. We're going to have some facilitated discussions for those that want to stay on afterwards. And we will also be having some speed networking, because even though this is a JBI Live webinar, this is actually a scoping review network event. Our network now has over 1,000 people who are signed up, interested to learn more about scoping reviews. And we're very passionate about it, not just being a newsletter list. We want it to be a very much a community to be able to collaborate together. So welcome, everyone. I have some people here to support me, thankfully. We have people behind the scenes, and I have to thank JBI Communications team who are letting everyone in and being really focused on that admit all button, because we're still getting more people to come in. We have Hanan, Khalil, Érica Brandão, Catrin Evans, and Lyndsay Alexander. And a bit later on, we'll also have Zachary Munn. So we'll be able to hopefully be able to answer all the questions that you have by the end of today. But first, I really want to acknowledge the land that I am on today, and that I know that we are on many lands today. So again, please acknowledge your lands in the chat. I would like to acknowledge that I am meeting on the traditional country of the Kaurna people of the Adelaide Plains, and I pay respect to the elders past and present, and recognise and respect their cultural heritage, beliefs, and relationships with the land. We acknowledge that they are the continuing importance to the Kaurna people living today, and we also extend that respect to other Aboriginal languages groups and other First Nations as well.
So it's my absolute pleasure today to introduce my friend and colleague, Dr. Danielle Pollock, to present to you all about extracting, analysing and presenting data in scoping reviews. Danielle is a research fellow within the Evidence-Based Healthcare Research Division at JBI. She is also the convener of a JBI Scoping Review Methodology Group and leads the JBI Scoping Review Network as well. I'd like to encourage you all to join the Scoping Review Network. If you ever have any questions or feedback on the JBI Scoping Review methodology, Danielle will be able to help, because she really is the expert and really does lead all of this work. So it is my absolute pleasure to introduce Danielle. I think we're going to have a very good time today addressing this tricky issue where there has been some uncertainty and a lack of clarity in the past, and Danielle's going to solve all that for us today. So Danielle, I think it's over to you.
Excellent. I think you've been far too kind in your praise. So you didn't have to, but thank you. Much appreciated. Let me just share my screen. So yes, I have the fortunate job to be involved in the Scoping Review Network and really talk to our community on a daily basis and answer any emails that come through. And it's absolute joy to be able to talk to everyone that is having any issues with scoping reviews. I pride myself on hopefully being able to take the guesswork out of scoping reviews. I would hate for them to cause any issues because I know how that feels. As I was saying earlier, my first one was called Lucifer, and that was because I felt there's a lack of clarity and direction in how to actually step-by-step guide how to do a scoping review. So I've taken that on board as at my job on JBI and really have endeavored to make as many resources as I possibly can in as many formats. So we do have videos, infographics, and also peer-reviewed articles, just to be able to assist in any way possible. But sometimes you just need to chat to someone. So that's what we are here for, okay? So I want to start firstly by saying what scoping reviews are, because I think there's still a misconception about what a scoping review is and how they differ from a systematic review. Now, JBI Scoping Review Group recently came up with a definition that is published in our JBI Evidence Synthesis Journal. And what our scoping review definition for us is that it is a type of evidence synthesis that systematically identifies and maps the breadth of evidence available on a particular topic, field, concept, or issue, often irrespective of source. So often in scoping reviews, we're going to include primary research, secondary research, non-empirical evidence in itself as well. Sometimes we solely rely on grey literature alone in our scoping reviews. And this is across any particular context. The things what I love about scoping reviews is that it's really not field dependent here, that what we have in our guidance can be applied to any field. So scoping reviews can clarify those key concepts, the definitions in the literature, and identify key characteristics or factors related to a concept, including those related to methodological research. So they're fantastic at being able to map what is available and ensure that we have clarity in maybe what we are measuring, how they are measured, what outcomes are out there, for example. So I feel scoping reviews are incredibly important for researchers, but also for decision makers as well, when they're trying to guide, well, what research has actually been conducted or not conducted. So we have a few reasons as to why you would do a scoping review. Now, any paper that I referred to, I have attempted to put a QR code there for you, and hopefully that takes you to that site. And so you'll be able to access any of the articles we have, but we also have our network page. So for scoping reviews, what we would say that they can do is identify any types of available evidence in a given field. So are we focusing more on qualitative research, or is there more quantitative research? What is the impact of that? Is there only survey designs? All that sort of stuff is what we're talking about. To clarify key concepts or definitions in the literature, for example, I wanted to know what stigma was in the context of stillbirth. So we were able to work out what that definition was related to stigma, what definitions were being used in the literature as well. What we found was that there was actually no one using definitions of stigma, and that allowed us to actually say, well, we need more conceptual clarity around this issue. Examine how research is conducted on a certain topic or field. So you can talk about what measurement tools are being used. Are we using a consistent measurement tools? Because that has implications for when we want to do a systematic review and bring all that information together. To identify characteristics or factors. Often scoping reviews can be a precursor to systematic reviews because it allows us to provide all that baseline information, allows us to ask, are we actually going to have any evidence available? You know, are they be able to bring this evidence together? Is it worth us doing a systematic review? It's definitely not necessary to do a scoping review before a systematic review, but it's often a nice precursor to do just to be able to see what's available. And also, one of the most amazing things about scoping reviews is it's able to identify and analyse knowledge gaps. What is there? What needs to be done? How does it need to be done? What call to our primary researchers can we make based on our scoping reviews? So just to highlight our resources here, we have the JBI Manual for Evidence Synthesis. This is chapter 11, and that's got a very detailed guidance. It is absolutely free, so you can access that anytime. We also have our Scoping Review Network page. This is just the resources page here, but here you'll find our JBI manual. You'll also find our templates and our publications from our Scoping Review group. I'll just stay there for a second for anyone that wanted to QR code that. But you'll find all of our resources, especially video resources as well there. And we're very thankful that we actually have some of these resources in Portuguese as well. So how would you decide between a literature, a systematic, or a scoping review? And this is often the million-dollar question. You're getting an idea, and you go, I want to answer this particular question. That sounds great. It's all very exciting at that stage, isn't it? The potential. And then you go, okay, so how do I answer this question? What is the best approach to be able to answer this question? And this is where we see a lot of people unravel, because they might not choose the correct methodology for the approach for the question they want answered, and for the impact they want that question to make. So I really want anyone who's planning any type of evidence synthesis to really stop here, to reflect, and to emphasize the process to answer that question. Now, there's many resources now to help you in your decision making for what is the most appropriate synthesis review. The Right Review tool, which is an online decision-making tool. It lets you ask you a series of questions, and it pops out with the most appropriate systematic review to do, or the most appropriate scope. If it's a scoping review, that's a fantastic resource. And I highly recommend that you go to that Right Review tool online. But this is where we stop and go, what do I want the impact of my question to be? Do I want to make impact clinically? Is my question going to change clinical practice? Is it going to change policy or guidelines? If it is going to make direct clinical change, where you are asking for people to change how they practice based on the results that I found and implemented in guidelines, which might change practice or even confirm practice, then you need to do a systematic review. Because systematic reviews are aimed at answering the questions of feasibility, appropriateness, meaningfulness, and effectiveness. If those are the types of questions that you are asking, then you are best placed to do a systematic review. However, if you're interested in more the characteristics or the concepts, mapping the available evidence, reporting, or creating discussion around these characteristics or concepts, then a scoping review is going to be the most appropriate choice here. But again, consider the impact you want to make. We often see a lot of scoping reviews that would be best placed to be a systematic review. People often think that scoping reviews are easier. I think every single one of us in the Scoping Review Network will tell you that they are not. They take as much, if not even more time than systematic reviews, because we tend to have large amounts of included evidence sources. And so when we're skipping the critical appraisal stage, it's not because it makes it easier, I can assure you. It's just it's not needed for these types of questions that we are answering. So myth busted number one, scoping reviews are not easier than systematic reviews. They are not less transparent. They are not less rigorous. They are just as transparent and rigorous as systematic reviews. So you're not going to benefit yourself by choosing to do a scoping review over a systematic review thinking that it's easier because we missed the critical appraisal step. There's my little rant over, I promise. So what are we actually focusing on today? As I said, I'd like to start on the difference between systematic and scoping review and when you'll choose which ones to do, because that's really critical to which process that you will do. Now, as I said, scoping reviews take a very transparent and rigorous approach, just as rigorous, just as transparent as systematic reviews are. So when you are doing your searching for evidence, your selecting of evidence, that is this very much the same as a systematic review. What differs now is when we're extracting our evidence, the analysis and the presentation of those results here. And so that is what we're going to focus on. A lot of the times, unfortunately, we see evidence synthesis and scoping reviews primarily overreaching for what it should be. For example, I've seen scoping reviews with meta-analysis in it, or more broad, interpretive levels of synthesis without any critical appraisal being conducted. And that's why those questions are best suited to a systematic review there. So we started to write this guidance to be able to provide that clarity. Now, this is the guidance we're talking about. It is publicly, openly available. Please read it. Hopefully it acts as a great resource and a great how-to guide. But we really wrote this because previously there hadn't been much evidence related to, or much information about how to actually do this step by step. I wanted to create a bit of a hand-holding guide, the guide that I needed in my PhD on how to extract and analyze and present the data. Because I knew those steps prior to this, I knew how to do those steps, but this was where I found the most difficulty in. So we're hoping to be able to create that clarity and the consistency in the approach for scoping reviews. Now, before I start any of this, I cannot emphasize throughout the entire PhD, and throughout the entire scoping review, the need for a team. If you are a PhD supervisor and you are asking your students to do a scoping review or any type of evidence synthesis, you need to be a team player as well. You need to ensure that you are that second reviewer, that you are willing to help extract, or you're willing to help find someone to extract, and that you can have this open communication. But not just open communication, it's going to be constant communication. Doing any evidence synthesis is hard. It is a form of research in its own right. It is not something that you just do on the side. And scoping reviews in particular can be particularly troublesome with the large amount of information that we are including in it. So we constantly need that open and constant communication, especially when we're coming to extraction, analysis, and presentation, because that stage, especially in the extraction, can be the most iterative stage in a scoping review. This is when you might go, oh, I need to re-extract something, or am I actually answering the question? So you have to constantly have these reflections on what you are extracting, and if you're extracting to the best way, that everyone understands what you're extracting, especially if you're working in a team. So you cannot reiterate enough the need for open and constant communication. When we do this, and I've mentioned and alluded to it, but just because this is a stage that's commonly done or has to be done in a systematic review, and that is critical appraisal. So once you have the evidence included in a scoping review, in a systematic review, you would traditionally then do critical appraisal on those included evidence sources. Now, in scoping reviews, we don't do that. There's really no need to do critical appraisal because we're not answering what is the best available evidence here. We're not asking how this evidence is biased and how that could potentially change the results or the validity of those findings. So we really don't do critical appraisal in scoping reviews. It's not common practice and not necessarily needed. So if you are being asked to do critical appraisal by anyone, utilize our resources that clearly say, don't do it. So when it comes to extraction, I'm sure many people who have extracted have felt that it is a never-ending story. I am currently extracting for a few scoping reviews now, and I can tell you that it is not an easy process. We have got over 300 included evidence sources in this scoping review. You will often find large scoping reviews because we have broader research questions here. And so it is continuing. And it is hard work because it's very detailed orientated work. And depending on how high level the extraction can be, it can be also quite detailed as well. So always when you're talking about how much time does extraction take, and we often get that question, how much time does extraction take? And that's really based on what resources you have available to you. If you only have 2 people extracting 300 evidence sources and you are doing double extraction, so each person is doing each one of those 300 evidence sources, it takes a long time. And especially if there's other competing interests that often occur. If you only have 20 evidence sources that you are extracting, fantastic. It might take a couple of weeks, but it takes a long, long time. So do not underestimate this stage. It is a lot of data entry. So often you will need lots of chocolate, lots of cups of teas or coffees to get you through. So just some principles when extracting evidence. It will change. Your plan will change. You can plan, and prepare as much as you want. And I definitely love planning, but sometimes it changes. So be prepared for those changes as much as you can. Accept that changes will occur to the data extraction sheet, but be prepared as much as you can. When you are extracting, ensure that you pilot your extraction sheet as much as you can. Pilot with each individual person who will be extracting for you. Make sure that you pilot if you're using different evidence sources. So if you have primary, secondary, guidelines, whatever you have included, pilot each one of those evidence sources, because each one of those evidence sources will have different issues associated with it and how they need to respond to the extraction. When you are extracting and piloting, cannot emphasize the piloting enough, you need to ask your team, do you understand absolutely everything we are wanting to extract? For example, what I mean by the objective, when I say, can you extract the objective? Do you understand what I mean by the objective? Same as the methodology. Don't underestimate it. Make this as clear cut as possible. Go through each one of these questions and ensure that everyone has the same understanding about what you are extracting. Ask how long this is taking. For example, you can take 5 minutes to extract an evidence source, or it can take you all day to extract an evidence source. And then you need to then look at your resources available and say, do we need to put more resources on this project? Do we need to change maybe how we're doing it due to resource limitations? But what I can say is this is an important stage that you should not skip, because this is where you can troubleshoot a lot of the potential issues that you're doing. Other questions you're going to ask during this piloting stage is the software working for you? Do you think that this is appropriate software to use for our extraction? Do we need to change our software now? So these are things that will help you later on in the track. We cannot emphasize the need for piloting and to test out each and every one of your forms. And it will be an iterative process, especially if you are going, what is the available evidence out there? What are the key characteristics or the key concepts? Sometimes you can go, wow, I really need to extract X, Y, and Z. And that wasn't on my initial extraction form. So your extraction form may change from your protocol. Changes are okay, just be transparent about it, okay? Talk about the fact that the extraction form has changed, and cannot emphasize, important to keep careful records. What version are you up to? That is your version control. This is I'm just putting an empty one with the title here because I just can't emphasize it enough, is to create an extraction information sheet. What I mean is something like this. This is just something I put on the, this was something I did for a scoping review I did. For example, I wanted to make clear about even how we would write the authors. So I gave them options, because when you're dealing with mainly textual-based evidence, which is what we're dealing with, we're not dealing with numbers here. How you write this in our extraction form will influence how clean our data set is to then be able to do analysis. So if you want to do analysis really easy, it's important at this stage to go, we will be putting NA in any empty columns, or we will say that the difference between yes, no, not mentioned, for example. you need to be clear about every single response. You need to be clear about how they should answer them, the format that they should be answering, especially in Excel, where that can change how you're then bringing that information together for your synthesis or for your analysis here. So creating your guidelines from the very start about how you want absolutely everything to be answered here. The next question we get is, where do I extract from? And the answer is anywhere that is relevant. That could include the title. It could include the abstract. It includes the methodology section. It could even include the discussion, anywhere that is relevant, but it's probably not going to actually be the results section. Unlike systematic reviews where you are actually extracting from the results all the time, that's what we're interested in. In scoping reviews, we're generally actually not interested in the results, are we? We're more interested in how those results came about. So we might say that these results were measured using X, Y, and Z tools. We can say that if they're, the way that they're presented statistically, but the actual results, we're not looking for correlation. We're not looking for relationships. So we don't really have to extract any of the results, do we? It might be rare occasions that we do extract from the results, maybe when we are looking at concepts and characteristics, but often we are not actually extracting from the results section in a scoping review. So what does an extraction form look like? It looks a lot like this. And I'm just going to emphasize, this is a clean extraction form, extraction sheet. During the process, you will find many extraction forms not being as neat as looking. This has been after analysis, so it's been cleaned up. But often it is done in Excel. We can have drop-down menus created in Excel, so we can help with the consistency. It is as clear as possible on the side as well. We had a person extract and then we had a person checking, or we had double extractions and then we're bringing them together. So it can be messy extraction and it can be overwhelming. And I'm sure everyone has felt overwhelmed during the extraction stage. So this is often what an extraction form would look like in Excel. Often we would give individual templates of these extraction forms to our extractors, and then they will bring it back to us. We might then check if there's double checking to bring them all together. So this is the process. It's a long process and it's a messy process, but this is often what they look like just on Excel. If you don't want to use Excel, and I completely understand why you might not to, Covidence has also developed extraction forms for scoping reviews. By saying that, it means you can develop an extraction form from scratch. Now, this is great, especially when you have these higher level questions that you can just click because, for example, endorsing organization. Everyone is then going to have the same response. There's going to be no spelling errors in that response, and it comes out really clean, the extraction form for Covidence, because of this. The only issue is if you get to this stage in Covidence where you've put a table in, then it becomes a lot messier and you have to do things in order. It's hard to reorder the table because it's not like Excel where you can copy and paste to make it in order of something. So if you are including tables like this, maybe you need to actually still stay in Excel for that flexibility. But if you're more looking at this type of yes/no questions with a few open-ended responses, then Covidence does extraction extremely well for that as well. So highly recommend the two programs. Of course, Covidence does cost money though, so that is a barrier to that as well. So this is what it looks like when you have completed your extractions and you're then doing consensus in Covidence. And again, you can do consensus through any way. I do it mostly either through Excel, where I can put the first reviewer, the second reviewer in 2 rows, and then my third row is me collecting all the responses essentially and making sure that it's clear and consistent. But for Covidence, you can do consensus in this within here as well, where you can just click this one and that becomes the final decision as well. So not only are you going to have to extract your evidence, you are then going to have to do consensus. And there's a lot of cleaning up in your extraction here. So that's why I'm saying it takes time. So then we're just moving on to data analysis in scoping reviews. And extraction can actually sometimes be the first step in data analysis. So it's important to have these conversations about how you're going to analyze your data, what methods are you going to use, how does that impact our extraction, what are we therefore having to extract. So this is what I mean, piloting the analysis sometimes as well with your extraction forms as well. So make sure that at each step you are reflecting, stopping, having that open and constant communication with your team on how to manage these issues here. So the types of data analysis that we are going to do in a scoping review are it's a lot simpler than what you would be dealing with in a systematic review. For scoping reviews, we are mostly going to be talking about descriptive statistics, so frequency counts, for example. If we are then looking at characteristics and concepts, or maybe barriers and facilitators, for example, we are more looking at a basic qualitative content analysis. So this is where we don't have high levels of interpretation here. We actually try to minimize the interpretation that we're doing in scoping reviews and just really keeping it to very low, minimal levels. And that's why we've got this basic qualitative content analysis. We often see people doing thematic analysis or thematic synthesis or meta-ethnography. Those are just approaches that are not appropriate for scoping reviews because they require higher levels of interpretation that are not required for a scoping review. That is the remit of a systematic review. So go to that approach if that's what you think. If you're going, I need to develop themes, you need to go to a systematic review. So how does this wonderful data extraction sheet turn into this beautiful presented table that was put in a scoping review that has just been released? Again, descriptives. All of this information here has been turned into counts. So the country studied, for example, how many times was it in France, how many times were in Australia or the US, and then that was being able to be put into this type of table. Same as the type of evidence source. So it's a lot of descriptive counting. And this is why it's important to have in especially Excel that how you write things is done in a way that can then be put into easy analysis. And you're not having to clean it up to then do the analysis, for example. So, if, for example, if you're writing the country, you could go a few ways to answer a country, can't you? You could go USA, you could do U.S.A, you could do United States of America, or you could do America. Now, all of those will come up as different responses when you then do your analysis. So this is what I mean. It's really important to extract, to format how you extract. So you can go, everyone, we are using United States of America, or we're using America or USA. You need to be clear and directive in your guidance here. Otherwise, you will get quite varying answers for the same response, and that can potentially bias what you are doing, what your findings actually are. So that's fairly easy for scoping reviews, and most scoping reviews won't need to go past descriptive analysis, okay? But what about qualitative data? This is when it gets a little bit scarier, doesn't it? And this is where I probably stuffed up my scoping review that I very first did, because I did thematic analysis. So learn from me. Don't read my first scoping review. But we are needing to go, well, what do we do here? Because I know this is often a sticking point. So don't do more than you have to do. If you don't need to do this basic qualitative content analysis because you're not answering characteristics or concepts or, organizing barriers and facilitators, for example, you're doing very methodological, for example, just trying to work out what the available evidence is, stick to descriptives. you don't need to do this, okay? This is very much only if you have to. But this is kind of the process that we have. We have put this in our recommendations, but you're going to go two ways here. So you have the immersion in data as the very first step. Now that's going to occur from extraction onwards. You're going to read that article, more than 3 times, because you're going to read it once just to see what it says. Then you're going to extract probably the preliminary evidence. Then you'll extract the actual evidence for this qualitative analysis stage. So, and then you're probably going to read it 5 more times. So you're going to get to know your evidence sources very, very well. But you're going to go 2 different approaches. You're either going to go the inductive extraction and analysis. So that's maybe when there is no framework available, and you have to develop a framework before you then start the extracting, or you're going to extract, develop the framework, and then you're going to reorganize the information into the framework that you have developed. So that's a far more extensive process here, and it's not one that is easily done, and it does take time. You then have this approach, which is the deductive analysis. So that could be that you already have a framework and you are literally answering yes, no responses. So that framework will be within your extraction sheet, and you are then looking at the data and you're going yes, no, for example, or whatever scale that you're using. So the framework's already being developed there. So just looking at a case study here, and this is a recently released article that I participated in with the lead author, Ellen Davies. Highly recommend reading that, as I think it's one of the best scoping reviews I've ever been a part of. So if you want an example of good scoping review, please go there, or to our JBI evidence synthesis journal. So when we looked at the deductive approach, you've got the immersion in data. That doesn't stop. And then you're going to say that the framework has already been developed. You're going to extract easily according to the framework, and that will already organize your information. And then you're going to review it and say, did this actually answer the question I need to answer? Or do I now need to go to an inductive approach? So there's still reflection associated with these stages here as well. So this is the extraction form that we did. And basically we wanted to know is, does the patient journey mapping evidence sources that we had, how do they kind of met reporting guidelines? So we had different reporting standards according to each evidence source type. And then you can see that we just put a star to see if it was actually there or if it was not available. This is a little bit messy to do and took a long time. But from there, we were able to create this table, again, very descriptive in its approach, to be able to do a deductive way to a framework here. And then we were able to say things like, the domain of research team and reflexivity wasn't often considered, for example. And we're able to make comment on the reporting within these patient journey mapping primary research studies that we had. So what happens when you maybe want a more qualitative question to be answered? So, for example, why were patient mapping studies undertaken? So we wanted to know, why would researchers undertake this particular methodology? That was a little bit harder. Obviously, no framework to develop, so we did have to categorize and use this inductive approach. Now, this often involves, it can be messy, I'm going to be honest, but we tried to break this down. So you're going to develop the theory or framework during this analysis / extraction process. It kind of becomes merged, this process. You're going to do some open coding. So that's where you're going to read your evidence sources, probably write all your initial thoughts, categories that describe the data. For this one, we had why was patient journey mapping undertaken? And then we just extracted any reason. So we had that information already kind of extracted that way. Then we did an open coding of those extracted responses. That then allowed us to develop a framework. And again, this is a very team-based approach. We then, from that, we developed that framework. We extracted from our already extracted data to then organize that information, and then we categorized it. So what does that look like? Well, it looks like a lot of meetings with a whiteboard. And I can't emphasize this process enough, is that sometimes you just need to get in the same room as someone to be able to work out, well, what do I need to do? So the extracted data that we did was here, communicative approach in describing patient's journey can shed light on opportunities and challenges to enhance care for better outcomes. These were our initial thoughts: inform, opportunities and challenges, improvements, better patient outcomes. This extracted data and other extracted data led to this category development of inform, health service, redesign and improvement. So how did we present this data? Well, we presented it in two ways. We presented it as a pie chart. So we were able to go, well, these were how the reasons why this was taken, and we found that informing health service redesign and improvement was the main reason. But we also, within the text, kind of narratively talked about each one of these responses, provided examples, extracted examples verbatim, to show you how we got that evidence as well. So it's a very detailed approach, but I think it was a good reason as to work out why we would do that particular method. So that brings us to other ways that we can present data, and how scoping reviews, I think, can be really useful to researchers. From this scoping review on patient journey mapping, we were actually then able to work out the different ways that patient journeys have been mapped. And the lead author, Ellie Davies, who created all of this, thankfully is a whiz visually, was able to then go, well, these were the different ways that evidence mapping occurred. So patient journey mapping actually occurred here. And then that would allow any researchers to go, well, utilizing this approach described by Davies, this was the map of how we actually mapped each patient's journey in the healthcare system. So again, this becomes a useful research resource for researchers who are then wanting to undertake patient journey mapping. But how else can you present your data? All I can say is that scoping reviews can be death by table. Of try to avoid it as much as you can. It's unavoidable. There will at least be one table in your scoping review, but there can be a lot in there. And remember that our main intention here is to communicate our findings to our readers. And if you want a reader to look at anything that is just tables, 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 you're going to lose them. So try to be as creative as possible in how you present your data to be able to communicate your findings. Think about if this was shared on social media, how quickly will this message about what I'm trying to say get across? So think of that type of strategy. Either way, anyhow you present your data, you must do a narrative synthesis. So you must describe it within the text. So you can't just say, here's an image of how many are in Europe or North America or South America, for example. You need to write it within the text as well. So that's an important part of scoping reviews. The only way I would say that we can make sure that scoping reviews are done well is to follow reporting guidance. So we have conduct guidance, which is our JBI guidance. So you'll on the conduct, you'll follow JBI guidance, but on your reporting, you'll actually do the PRISMA-ScR. So look at that PRISMA-ScR because it is there to help with your reporting. Most journals require you to submit that PRISMA-ScR report with your journal to be able to say that, yes, I've reported on X, Y, and Z. There's 20 items, and it's crucial that you follow both JBI guidance in the conduct, but follow the PRISMA-ScR in the reporting. And this is a shameless plug to join the Scoping Review Network. We would love to have you. We do newsletters, develop resources. We highlight your own work as well as we want to highlight our community. So please, please, please join our network. But thank you very much for listening to me talk about the extraction, analysis, and presentation of data and scoping reviews. And I'm hoping it clarified what way you should go.
Fantastic. That was wonderful, Danielle, and super helpful. And I can see lots of people are saying thank you in the chat as well. And there was great discussions from everyone and some questions as well that did come up in the chat during your presentation. But I think you've really made a process which has been very difficult and confusing for some people a lot clearer with some really practical tips and tricks. So thank you so much. And look at that, so many people are saying thank you as well in the chat. Well, we did get a lot of questions that did come in, and it's my absolute pleasure to introduce some other members of a JBI Scoping Review methodology group as we get into a facilitated panel. So it is my pleasure to welcome Catrin, Lyndsay, Érica, and Hanan. If you can all just put on your cameras. And we might do a very, very quick introductions from everyone before we get into the Q&A. Catrin, would you like to go first?
Yes, hello everybody. I'm based in England at the University of Nottingham, and I'm also a member of the JBI Scoping Review Network and a Professor of Evidence-Based Healthcare.
Wonderful, thank you, Catrin.
See so many people here.
It is, it is. Next up, Lyndsay.
Hi everybody, yeah, and echo, wonderful to see so many faces tonight, it's great. I'm Lyndsay Alexander, based in the School of Health Sciences at Robert Gordon University in Aberdeen in Scotland, and I'm Deputy Director for the Scottish JBI Centre and also a member of the Scoping Review Methodology Group, which is fab.
Wonderful, thank you, Lyndsay. And we have Érica here as well. Érica?
Hi everyone. I'm Brazilian and professor from Federal Fluminense University and adjunct member by JBI Brazil.
Wonderful, thank you, Érica. And Hanan.
Hi everyone, and I'm based in Melbourne, and I'm an associate professor at La Trobe University at the Department of Public Health, and I look after research and industry engagement. I've been with JBI for about, I would say, 12 years, and I've been a member of the JBI Scoping Review Group since its inception.
Fantastic, thank you, Hanan. So you can see we've got a great panel today from across the world as well, and we are all ready to answer your questions. So please do put your questions in the chat if you do have anything you want to ask. One of the questions that did come in, and maybe Hanan, we might start with you. Someone asked, what about rapid reviews and how do they stack up against scoping reviews? Hanan, do you have any thoughts about this?
Yeah, we actually, at the moment, we're writing a paper on rapid review. Actually, we wrote a paper already on rapid reviews, and in general, but rapid reviews, it's not a methodology like umbrella review or scoping reviews. It's just a way of undertaking a particular review. And in the actual guideline of undertaking rapid reviews, you can pick and choose what you would like to do when it comes to the different steps of scoping reviews. So for example, with the data extraction, you can, or screening, you can choose whether you want to have one reviewer or two reviewers, and so on. But it doesn't really, it doesn't affect or impact as much on the methodology. It's just the way you're undertaking the actual review. I'm happy to find the link for the rapid review paper that we all published, and then just put it in the link there.
Oh, that'd be wonderful. Thank you, Hanan.
Yeah.
And Catrin or Lyndsay or Danielle or Érica, did you want to add anything about I guess, distinguishing between scoping reviews and rapid reviews?
I always kind of just say that rapid review is how it is conducted in terms of, so a rapid review theoretically could be done in any evidence synthesis type. So it can be done in a systematic review. It can be done in a scoping review, although there's not a lot of guidance on that, and I'm dubious on to how that is actually done. But for me, a rapid review is really evidence synthesis with shortcuts. So, you know, try and avoid them is what I would say, unless you absolutely need to get that evidence done quickly. For example, in COVID-19, it was really critical, but really, unless that's required by your people that are funding, I'm not sure the need to do them that's probably controversial. Zach?
I think, well, you know me, I think I agree fully, Danielle, that rapid is a mode of doing an evidence synthesis type. So it could be a rapid review of interventions, or a rapid qualitative evidence synthesis, or a rapid scoping review. And as you say, it's really the term rapid, even though it says rapid, it actually normally means methodological shortcuts. I think you've really clarified that for everyone, Danielle. Thank you. Great, good discussions. Okay, Catrin, perhaps for you, there was a question, someone asked whether or not we would classify scoping reviews as a descriptive methodology compared to systematic reviews that are analytic. Do you have any thoughts about this?
I think that's probably quite a good way of characterizing them, in the sense that, generally speaking, you're doing a scoping review to characterize, map out, understand, summarize a concept or a kind of field of evidence related to a particular concept. So in that sense, you are describing and perhaps more than describing, characterizing and exploring and you know, interrogating perhaps the kind of nature of evidence and the type of evidence in a particular field or related to a particular topic. But yes, you're not generally synthesizing or developing a complex analytical output or interpretation. So you know, perhaps that, so descriptive versus analytical, it might be useful. It's perhaps a little bit simplistic, but if it helps, then that's probably quite a good way of trying to understand the difference.
Thank you. So that's it's a nice way to conceptualize perhaps some of the differences between systematic reviews and scoping reviews. Does anyone else have anything they wanted to add here? Danielle, I think you've used some terminology for different review types. That's something perhaps explanatory.
Yeah, descriptive, explanatory, high levels of interpretive. I think I mixed a lot of it up.
No, that's good. I mean, sometimes it can help grouping these, and there's some other people have started calling scoping reviews, mapping reviews, these big picture reviews that provide this larger picture of as opposed to systematic reviews, which often focus and have a more narrow scope. Very good. Wow, we're getting lots of questions in. This is fantastic. Earlier
Zach,
on, yeah. Oh,
sorry,
please,
Zach.
no,
Can I?
on.
Yeah, can I just clarify? That's a very good question, and actually, it's some of the work that I'm currently doing at the moment, trying to differentiate between scoping reviews and mapping reviews. And we've published a paper at the beginning of the year about the differences between both of them, and we're currently as well trying to scope what a mapping review is. But if you want to know without reading the actual paper, it's basically scoping review. It's about what's in the evidence, whereas mapping review, where is the evidence? So scoping review, there is a lot of data extraction. You will be able to extract things like barriers and facilitators, whereas mapping reviews, because they're generally done on a larger number of studies, and it's a little bit hard to extract a lot of data, so they're mainly descriptive. But watch the space for the upcoming methodology on mapping reviews. Awesome. I'll actually put in the link, if you like, for the differences between both of them too.
Yeah,
I already put the link into the chat about your mapping, and because as soon as I saw it, I'm like, that is the article I'm finding.
Thank you.
So this is great. These are really good questions, and questions we're tackling as a scoping review methodology group and broader as well. I think the distinction in those terms was explanatory versus exploratory, Danielle, which
that's the one
talked about in the past as well, to describe scoping reviews compared to systematic reviews. Great. All right. So let's have a look here. Gosh, we're getting lots of questions in. This is very exciting. It's testing my...
Well, I'm not sure the breakout rooms are going to work, so we might be doing the Q&A.
Well, I've got a question for Lyndsay. So someone mentioned, is it worth noting the limitations of included studies in scoping reviews? We've talked about critical appraisal and whether or not you should do that. Lyndsay, do you have any thoughts about describing the limitations of studies included in scoping reviews?
It depends on, well, I'm thinking that could become a very big hole. in terms of limitations. You're cruising towards methodological quality. You're maybe thinking about other limitations of just, you know, is it ethnicity within that, you know, the population that's presented, is it generalizable? There's quite a lot in there, and is it actually relevant? I think the scoping reviews I've been involved in are quite a large undertaking. And as Danielle's touched on, if you're scoping, this can be iteratively quite big. Would you want to then go in and start looking at limitations as well? If it's just of interest, it's keeping it to the question for me. And for me, I would start to go, what limitations do you mean? What do you define by that? Because if we have other people extracting data as a team, I would go, and what's that going to add to the scoping review? So I would feel that critical appraisal is not required. So unless there's a good justification in a paper and the protocol, I wouldn't go there. I'll open that up to the rest of the guys. But I wouldn't really go there.
I think if you're going, well, what is the available evidence out there and what are the limitations that they're maybe working with? For example, I'm thinking of my research in stillbirth, where we're dealing with a lot of research that says that they had troubles recruiting bereaved fathers. I think, and that is therefore a limitation of our study. That can work, and especially if you just go to the limitations section of their report and just say that's where exactly we're getting it from, maybe that would work, rather than us assigning what the limitation was. Then that might help in that situation as well. But I'm happy to hear anyone else's thoughts on that.
Hanan?
Yeah, sorry. Yes, I'm currently doing a scoping review, and we are extracting limitations of each study. And the objective of that particular scoping review is really about clarifying a particular methodology. So yes, you can extract limitations if it depends on the research question. So for us, this was very relevant because I was interested in the methodology that people were using and the limitations that they cited, that the researchers cited for that particular methodology. So it depends on your research question, I guess.
I think that's right. Depends on what your research question and aim is of your scoping review, and also what you describe as a limitation or define as a limitation, right? We're not always talking about necessarily risk or bias, but we may also just be saying what sort of study design it was, and maybe if there's lower levels of study, when we extract those designs, maybe that could be classified as a limitation, for example. So thank you, Hanan. Hanan, might just stay with you because you're the guru when it comes to automation and software and tools in this space. And there was Danielle did talk about Covidence and Excel and some other methods for extraction, but there was quite a bit of chat as well about different tools that we could use. I know you put a link in the chat as well, but did you want to just mention about some of the tools that can be used for data extraction and scoping reviews, and perhaps the potential for automation in this field?
Yeah, look, very briefly, as I mentioned before in the chat, though, we've got a paper that's under peer review at the moment just for automation for scoping reviews. And we've published also another paper about automation for systematic reviews in general. Now, the tools that I've put in there, they're not all the tools that are out there. They're only the tools that have been validated and tested on small studies. Now, so for example, with data extraction, I did cite before Distiller, Abstracker, and also Covidence you could use because they have been validated. One of the biggest problems validated before on using systematic reviews before, one of the biggest problems for automation is that when they were validated on particular topics. So, you know, and when they are validated around the occurrence of particular keywords. So you can see that when you actually use the same, say, Abstracker or Distiller for your own topic, which might be different, say, for example, not necessarily healthcare related, it could be on cancer, or it could be on diabetes. So you won't have 100% accuracy because of the differences in the keywords that have been used. So most of the, and that's if you look at the validation studies that have been done with Abstracker and Distiller, they will say, look, you know, one of the limitations that we haven't tested on a huge corpus of evidence. So they've only used, they could have used things like generic health sciences papers, but not necessarily about, you know, oncology papers or diabetes paper or something like that. So just be mindful. And I think with the automation tools in general, it's best to, if you want to use it, I think maybe you can use another reviewer, a human reviewer, just to make sure that the extraction or the screening is actually, you know, you've got the highest accuracy possible. I don't think we are up to that stage yet where you can use 100% automation tools for each stage of the scoping reviews or systematic reviews in general. I don't know. Sorry, that was a long answer to a short question.
No, it's super. It's a great overview of a field and some of the challenges and where we're at the moment as well.
I also just wanted to highlight, I put the systematic review accelerator tools, which are done by Bond University, in the chat, and they have a lot of tools that can also help, not necessarily reviewed or evaluated, but things like the search refiner tool is good when you're just trying to put the search into different databases. The deduplicator tool is also very, very good if you're trying to get rid of your duplicates in a way that's sensitive and systematic. So highly recommend that. And I just saw someone, what software would you recommend for extraction? I think if anyone can develop an extraction automation tool, that means that we don't have to extract. I would pay $1 million for that. But right now, I think the only real extraction software that tends to work is yourself and Covidence and Excel.
Thanks. Thank you, Danielle. And I think, you know, it is a matter of preference as well. And some people will use different systems that they prefer or have access to, because there might be some financial barriers as well. So there's no right or wrong. But as Danielle says, we've found Covidence is quite good in most cases. There was a real specific question, and Danielle, I might pass this to you. How is Covidence different from NVivo?
So I think NVivo is very specific to qualitative synthesis, where you're kind of organizing and finding similarity in meaning, and you know, so very much suited to that. Covidence wouldn't be able to necessarily do that. And I find that NVivo is more on the analysis side, whilst Covidence is more on the extraction side.
Very good, very good. And yes, NVivo is really quite advanced qualitative software analysis packages to develop themes and word clouds and all kinds of neat things that you can do. Great. Well, we're still getting lots of questions in. There was another question about distinguishing between scoping reviews and systematic reviews, and one of the attendees mentioned that they've said regarding the statement, to develop themes, you need to do a systematic review. They've asked, would that still be the case for an open-ended research question? They typically use a heuristic of closed-ended question equals a systematic review, and open-ended question equals a scoping review. But is that too simplistic or just wrong? What do people think about this? Is a closed-ended question a systematic review, open-ended question scoping review? Is that another way to distinguish it? Érica, do you have any thoughts on this, or Catrin or Lyndsay?
I can perhaps just start. I think that might be slightly problematic to characterize it quite like that, but I think we would need some examples there. So I'm personally more of a qualitative researcher, so for me, an open-ended question, you could ask a fairly open-ended exploratory question where you're seeking to understand a concept or an experience and not predefining it, but that could still lend itself to a qualitative systematic review, for example. And likewise, a closed question might be very relevant for more of a sort of quantitative systematic review. So I'm not sure that that would be would be a helpful way to look at it. I would say.
Thank you.
Or others might think. Yeah.
Yeah, I think we're going to go narrow versus broad. Some people do that. You know, that if you look at the question framework, we've got the P code for the systematic for like questions of effectiveness. So you're adding more elements, so therefore make it more narrow. And then the PCC for scoping reviews, which is just population, concept and context. And even then, you don't need any of those, you just might not have the context. So that can make a very broader research question. And so I think it really goes back to what are you actually trying to answer, more than anything about if it's narrow or, you know, broad. I don't know if those are helpful terms to use.
Zach, can I just give
Yes,
an
please.
example? Yeah, can I give an example of a scoping review that we've published a couple of years ago? Scoping review questions can be closed. For example, if you're interested to identify the characteristics, say, of mitigation safety programs, the actual outcomes that these studies have been collecting. So that's a closed question. And but again, a scoping review would be very suitable to use methodology, whereas you can't use a systematic review for this one. So you can use closed questions. It depends on closed questions rather than open-ended for scoping reviews. It depends on what you would like to extract and see there. So people may be interested only on the outcome measures of a particular interventions. So you want to map that. Yeah.
Great, thank you, Hanan. Really good discussions. Thank you, everyone. There was a question. This is an interesting question. So from one of our attendees, they're doing a review of health indicators. They've found 300 records or studies. It's not going to be feasible to extract all the information from all 300 studies. So they've decided to use a sample of 15% of the studies to extract data from. And they're asking, in this case, would we consider it a rapid scoping review? And if not, what else could it be called? What could the label be? Does anyone have any thoughts about this? No, I can see you.
It sounds like a methodological study.
Yeah, okay. What do you think?
Hanan?
Yeah, Zach, you're the best person to answer this one. It's exactly like what Danielle said. It's a methodological study. Yeah. I'm stuck. I don't know what the answer is, but I mean, I'm currently doing a scoping review with everybody in the panel here with 400 studies. So I'll keep going. I'm adamant to extract all the data from these 400 studies and see what I'm going to get at the end.
Good work, Hanan. There was a few in the chat. You mentioned that. I think Cindy mentioned she had around 500 studies, and some others were saying they're doing big scoping reviews. And we need to lift each other up, which I thought was lovely. So regarding this question, I think there's a couple of things you could do to describe it. Maybe it is a rapid scoping review because that's one of your, I guess, shortcuts or limitations, that you're just using a sample of the studies that you actually identify. Or it may be better described as some sort of cross-sectional methodological study, and then where you are using a random sample as well. Sometimes methodological studies and scoping reviews, they do overlap a lot in their methods and approaches, and this is something we're discussing at the moment as well. Of course, the most important thing may not necessarily be the actual label. It's actually just being clear and transparent in what methods you used, so that any reader can see what you did and how you did it, and there's no confusion about that. So the most important thing is to say what you've done very clearly, why you've done it, and to provide some rationale for your choices as well. I think for any research project, of course. Very good. All right. There's some more questions here. someone has asked, if you're looking at a concept and we find it is only mentioned in the title and not discussed again, is it best practice to include that or to make mention of it, even if there is no further discussion of a concept? So I guess this question is really getting at, if you're doing a scoping review and the data extraction item or element is only, say, mentioned in one place or even only in the title, should we still be including that study? Lyndsay, do you have some thoughts about this?
Well, it marries up to a question we've been having in a review I'm doing just now, a scoping review, looking at hydrotherapy and aquatic therapy with clinicians. And it's we've had a lot of debates about, should we include this piece of evidence? There's not lots out there for the specific area we're looking at. However, for some of them, they're very poorly reported in terms of the clarity of the data we're looking for. So we've gone round and round, and actually with what we've got to the point is that's a reporting point in terms of recommendation for how people report the content or the practice or the methodology or the intervention that they're doing. If it's just one thing mentioned, then we feel we need to flag that up in this area, that this needs to be done better, rather than just allow it to keep continuing. So we can understand there is a point where you can't extract data from some sources of evidence. But if it has maybe just one line in the discussion that's relevant, we're actually going to extract that, because we would like to just show, and this was in the kind of piloting phase of extraction that we're starting to notice, and it really fed off the back of full text review. So I would probably say, depending on the question, depending on the group and the focus of what is relevant to this scoping review, it could be that small amount of detail that you're actually going to extract. So there's the depends question, but think about what it's going to be used for, I think is the, that out there.
I think that's a great response, Lyndsay. We don't normally limit scoping reviews in terms of where you extract data from. So it's not like you can only extract data from, say, the results section or the method section. You can really extract it from anywhere in the article if the purpose and your needs actually require it for your scoping review. So I think that's a really good response. Now, there has been some discussion about scoping reviews and qualitative evidence synthesis. And I might go to Catrin, because Catrin, you're also the co-chair of the Qualitative Evidence Synthesis Methodology Group at JBI. And someone has mentioned that they're exploring the experiences of patients, and they're wondering if they need to extract quotations from the primary study in the extraction table or sub-themes. Catrin, do you have any thoughts?
Okay, yeah, sorry, I can't see the actual question here, so I'm not sure if there's any more detail being provided. I think it's quite a difficult one to answer without knowing a bit more detail about what the actual objective of the synthesis is.
They've talked about exploring the experiences of patients.
Yeah, so I mean, first off, it possibly sounds a little bit like that might be more of a systematic review, but if you're just trying to sort of very descriptively sort of highlight how those experiences, say, have been categorized across a whole range of different studies, you could do that as a scoping review. So sorry, I've just missed that last thread of the question about, is it coding, is it
extracting
using
quotations,
extracting quotations.
Extract quotations from the primary study,
right?
Or should they extract sub-themes or themes?
Yeah, well, you wouldn't extract the quotations. You might extract the quotations in order to illustrate the theme or sub-theme that you're extracting, but generally speaking, you'd be extracting the actual findings, so themes or sub-themes, and finding a way to categorize and describe those. The actual quotations can be used later on to perhaps to illustrate the meaning of a particular theme or sub-theme.
Yeah,
but so I think without knowing a little bit more detail, it's hard to sort of give a more sort of elaborated answer on that. But
there was a related question, Catrin, about the differences between scoping reviews and qualitative review syntheses. And they've said, particularly when the question is about barriers and facilitators, but would you mind just talking about the difference between a scoping review and a qualitative evidence synthesis?
Okay, well, I think, I think the barriers and facilitators one is quite a good example of where a scoping review can work quite well if you're just trying to, if you're trying to sort of understand a particular phenomena, a sort of health behaviour or the implementation of an intervention, and you're sort of trying to get a sense of what some of the key issues and challenges are. If you're trying to just perhaps map those to a pre-existing framework, then the scoping review might be appropriate. But if you're trying, for example, to understand sort of mechanisms or processes in a more in-depth way to really kind of understand a particular phenomenon or behavior or social process, and to explore it and sort of understand patterns related to it and relationships between it, I would say that would be more of a qualitative evidence synthesis. But if you're just describing what are the barriers that people have described in the literature, what's the range of them, and how might we categorize them, maybe into different levels like organizational or individual or social, then you could do that as a scoping review. I think it really comes down to the level of sort of analysis that you're planning to do. So again, like Danielle said before, it really comes down to the actual question. What's the actual purpose of the review, I would say.
Yeah. No, I think that's really helpful. Thank you, Catrin. We are getting to time, I think. It's now 8:30 local Adelaide time, which is the advertised end time for this session. Now, I think what we're going to do, though, is we're going to wrap things up in this large main session, but then some of us are actually going to stay around and be available to have some discussions with you, and we'll even jump in the breakout rooms if you have more specific questions. So obviously feel free to head off, but if you want to stay around and have a chat to some of our members from the JBI Scoping Review Methodology Group, we will be facilitating that as well. Just before we finish up today, we might just go through, see if everyone has any last thoughts, words or advice. Hanan, we might start with you. Any concluding thoughts, advice, tips or tricks or anything else for the attendees today?
I guess just read our articles, spread them around.
That's good advice. All the resources are there. Thank you, Hanan. Catrin, any thoughts from you?
Yeah, I think that's right. I mean, just recently the group has published very clear guidance, and I think particularly on that question, the paper, Zach, authored by you, scoping review or systematic review, I think that's the place to start, because that's the key question in a way. Once you're sure what you're doing, then everything follows from that, really. So it's you use the tools that have been suggested to help you decide, is this a scoping review or is it a systematic review? Once you're clear, you'll be fine.
Fantastic. Thank you. Good advice. Take the time at the start to make sure you're getting the direction right. That's great advice. Lyndsay, any thoughts from you?
Yeah, I think absolutely what everyone else has said, and also I think hopefully today and with the paper we've published regarding how to present and analyse the data, I hope that has really helped everyone to just get a bit more clarity in that, because we really felt that was an area that it was a bit of a black hole and people just had to figure it out for themselves. So hopefully, going by the attendance today as well, I'm hopeful that's really helped, because it's really important for a scoping review to do it well.
Definitely. And once again, huge thanks to Danielle, who led this work to try to bring some clarity to this stage of a scoping review. Érica, do you have any thoughts that you wanted to mention as well?
No, thank you.
Thank you, Érica. And Danielle, any concluding tips, tricks or advice from you?
Don't hesitate to reach out and ask for help. we're available to answer those questions for you, either through our emails, through our network page, open and constant communication with your team, and, you know, just enjoy the process as much as you can.
That's awesome. That's right. Enjoy the process. Have fun.
Yeah.
Because it's fun, right?
It is fun.
Very good. Well, thank you everyone for attending. I know we didn't get to all of your questions. Please do reach out to us via Twitter or email if you do have any questions. I'm going to formally close the panel session today. And once again, a huge thank you to Danielle for preparing and presenting today. An excellent topic and presentation. And a big thank you to our panel members as well, particularly for staying up late or getting up early and joining us today. So thank you, everyone. I'm going to stop the recording now, and thank you all for coming.